Well, this is Dr. Stanley Lang. Welcome to this broadcast. The topic is on how to stay healthy through whole person health. And so I'd like to talk a little bit about that and talk about 3 different patient examples that I saw today. But also I want to introduce or reintroduce, if you've seen other videos that I've done, the concept of squaring the curve, which is an idea developed and promoted by Dr. Kenneth Cooper, who is the father of the aerobics movement and who has this idea that is actually based in very good science, that we are actually designed by God to live at a high level of function well into our 8th decade of life. And at the Cooper Institute, where they've been doing aerobic and other exercise-related research for many years, there's good evidence that this is true, that if we live the right kind of lifestyle, that the idea that we're supposed to decline, as this curve C indicates, that's our normal aging, that's what we should expect with aging, that's a myth, and it happens because we let it happen. So he believes, and the evidence seems to support, that with the right kind of lifestyle, that we can maintain a high level of function like the green line at the top shows. And then at the end of our life of high level of function, our DNA clock essentially runs out. And over a period of a few months, we die. And then we don't suffer a long time through many, many decades of slow decline. Now, obviously, that's not the usual approach that people are experiencing nowadays. The question is, what's the best way forward to gain that approach? So I would like to promote the idea, again, of whole person health as the best way forward, but also to show the limitations of just relying on 1 or 2 things. So I mentioned that I refer to these 3 different curves, and they actually refer to 3 different patients that I saw today, all reflecting a different place on this strategy of squaring the curve and having whole person health. So the first person is somebody who is living essentially the lifestyle that Dr. Kenneth Cooper talks about. She exercises significantly, but not excessively. She eats very carefully. She's in her upper ages. I won't say the exact age, but she's at a high level of function with absolutely no physical or cognitive limitation. She can do anything she wants to do and will likely be able to do that for another 10 to 15 years. The second person is somebody that you can see their curve sort of dropped and then it started to come back up. Now, the reason it dropped is that this person lived a lifestyle that did not pay attention to the basics of eating correctly, eating healthy, and exercising, and in fact had a heart attack about 10 years ago that was truly a near-death experience. This person was brought back to life, literally on the table 2 times, and has lived to tell about it, and since then has adopted these lifestyle strategies somewhat. Today, the discussion was the fact that this patient was failing to integrate exercise appropriately. So what could he do to do this? And so we talked about a simple high-intensity interval training program that I teach my older patients that is safe to do and can be done in 30 minutes or less. And a combination of this high-intensity and strength program, simple strength program, can provide the average person who is wanting to age well effective exercise in both cardiovascular and strength on just 30 minutes a day. That's achievable by anybody that is serious about doing something about this. The third person was somebody that thought that she was in pretty good shape because her body weight was roughly approximately what it's supposed to be. She was a little bit overweight, not too much. But it was clear looking at her that she was severely deconditioned. And in fact, you can be normal weight and obese because the person who is who is normal weight and obese has lost so much skeletal muscle and replaced it with fat that they are just flabby. And so that person is in the same situation metabolically as somebody who is obviously overweight and flabby. So the third person, I spent a lot of time trying to convince that there was a lot of opportunity for her to turn things around. And of the three, she was younger by 20 years and looked the oldest. It was a great example of how we allow ourselves to age by lifestyle strategies. Now, she's got plenty of time to make that C curve look like the B curve. She's not going to ever make it look like A because she's wasted too much time, but she can definitely change the trajectory that she's headed on. And right now she's heading on a crash and burn in another 15 years if she doesn't change anything. So my encouragement to you is that you can change things by paying attention to health of body, mind, and spirit. Now, I want to emphasize that all three of these people have a very deep spiritual life. They are all committed Christians, and they love God. They love the ways of God. They live their faith. But all three of them are at a different place in their health because they're not paying attention. They're not equally paying attention to the fact that we have physical bodies. And whole person health does not just mean spiritually healthy. So Christian health doesn't mean being a good Christian. It means having whole person health. God didn't intend Christians to be flabby and out of shape and having premature disease because they weren't paying attention to their bodies or to their mental health. So we should be paying attention if we are followers of Christ, or if we are in any way kind of spiritually minded, we should be paying attention to our physical health and our emotional health in addition to our spiritual health if we want to enjoy the plan that God has for us, which is to have this kind of health. Now, Dr. Cooper's research suggests that, actually showed, not just suggested, that a person who in their 80s, at 80 years old, can run a 15-minute mile, has over a 70% chance of living till 90 with a high level of function. Now, imagine this. This is a study done on 80-year-olds who run. Not too many of us know any 80-year-olds that are running, yet this is a study that looked at 80-year-old runners. And these are people that haven't had to spend their whole life doing exercise. I just indicated that you can have a good strength and cardiovascular fitness program for 30 minutes a day if you do it right. And my encouragement to you is that you take advantage of the opportunities you have. All you have to do is invest 30 minutes a day in the right exercise program, eat the way God intended us to eat, and have a good spiritual life, and you're going to have a high chance of living this top curve. Now, nobody knows the future. We can't guarantee everything, but these are the ways that we're wired. And I want to encourage you to sort of see this as the probability that that's what God wants. Now, He may have a special plan for your life that's a little bit off that, and maybe include some suffering that most people wouldn't have. But for most people, I think that He wants us to experience the gift of health the way that Dr. Kenneth Cooper, with Squaring the Curve, envisions it. So I encourage you to embrace that, at least have your mind open to it. God bless and have a great day.